This is a quick overview of wound care products and procedures. The first thing you need to know is hydrogen peroxide and betadine. You shouldn't use them but the first 2 days at the most. They kill growing tissue. So we've had patients come in that haven't healed the wound for months, and it's because they use hydrogen peroxide all the time. What you need to use instead is normal saline is one of them. You can flush the wound out with it, pour it in, and it also comes in spray bottles, or you can get yourself a spray bottle. You can get normal saline at any drugstore. Acetic acid is another thing you can use. You can make your own acetic acid with vinegar. Uh, Vinegar has acetic acid in it, and that's about the same as a woman's douche with at 1/4%. Uh, I'll show you how to make that on the web page. There are new wound cleaners coming out all the time, and you can buy them at any drugstore or pharmacy. The spray that that's comes with the bottle, the sprayer will help flush the debris out of the wound and clean it. Microcin, that's one of the many products that are coming out with it's same as Dakin solution, which is has a small percentage of Clorox in it to kill bacteria. You soak it for about a wound for about 15 minutes. You can kill all the germs in it. Hybocleanse, you can clean around the wound. You just need to make sure you flush it or wash it off real good. It kills bacteria and many different germs. There's a way to, some wounds have little tunnels, little holes that go deep, and you can get a hold of a IV catheter and put on a syringe. Fill your syringe with the normal saline, acetic acid, Dakins, whatever, and flush it. Some of the products that go in the wound are like hydrogel. Hydrogel is just to keep the wound moist. It doesn't have any antimicrobials to it. Silver Med is a hydrogel with silver in it. Silver is an antimicrobial. It'll kill germs. Multidex is a type of medication you put in a wound that doesn't have any antimicrobial to it, but it'll increase healing. Idasorb gel has some iodine in it. It'll kind of dry the wound up if your wound is draining a lot. Now honey, Medi-Honey, there's coming out with different types. What it does is many different things, but it helps heal the wound. There are different types of products that like calcium alginates that are you put in a wound. It helps absorb the drainage. At the same time, the calcium alginate has silver, or you can get it with silver, and it's antimicrobial too. Zero Form is another one you can put in a wound, and if it when you put it in a wound, you need to make sure you just put one layer of it. If you put too many layers, it'll macerate the wound. Now, Adaptic is just, you put it in the wound, it's mostly just to keep other dressings from sticking to it, into the wound. TheraBlue has some antimicrobial in it. Puricol is a collagen. There's many different types, brands. This one has silver in it. You put it in the wound, it kind of makes a scalpel, and it has some growth factor. It helps the wound grow. Acticoat's a real high silver content. It absorbs drainage, and Sorbact has another type of antimicrobial to it. Duoderm is a has some healing to it. Plain packing is something that you and iodoform packing, also a silver type of packing. It goes into a tunnel. You kind of have to lightly pack it into the tunnel so it makes a wick and draws all the drainage out of it. It helps slowly close the tunnel up. The Duoderm, like I was saying, has uh, sticks into the wound bed itself and to around the edges. It will help keep from doing more damage to wounds. Usually leave it on for 2 or 3 days. The Optifoam is a foam that has adhesive. Uh, you can put your other dressings or other medications inside the wound, and then you put your foam on top of it. There are foams that are not adhesive. You can tape to them. The ABD pad, of course, is just like a Kotex. It absorbs drainage, absorbs the blood. You tape it on, or you can roll Kerlix around it to hold it in place. But it's just like a Kotex or a diaper. It sucks up drainage. You can use Kotex a lot cheaper. You can buy a box, a lot cheaper than you can a pack of ABD pads. These non-inherent dressings, they keep from sticking to the wound. A lot of bandages will and ABD pads and things will stick into the wound and makes it hard to get out. It's painful taking it out. There's like sure strip. You can use that to cover your dressings, and it will keep it dry. It's also good for skin tears, just little skin tears, and it sticks directly to the wound itself. The thing about these products is just like tape. Paper tape is the best thing for it. Some people break out with a rash, and it irritates them. So paper tape is the best type. Also, compression wraps are important in wound care. It reduces the edema, especially in the legs. You put it over the top of wounds. Of course, you put your dressings on first with an ABD pad or something, and then you wrap this Kerlix, these wraps around your leg to reduce edema, and it makes healing faster. There are many different types of wound dressings.